Hello everyone, so we can start the session now. Let me check, is the screen clear and am I audible, and then we can start the session. Yes, so just let me check. Yes, so today we are going to start the session, and this session is targeted for the upper limb clinical anatomy MCQs, targeted for the INICET examination. And what I want you to know is that followed by this session, another session will be of lower limb clinical anatomy MCQs. So two sessions I am going to take one after the other. So firstly we will cover up the important clinical aspect related to the topic of upper limb, which is very important and needs to be revised before the examination, and then we will move on with the lower limb clinical anatomy. In between I will give you 15 minutes of break. So okay, so the next session will be 7:30, and let's firstly complete the upper limb clinical anatomy MCQ series. Okay, so yes, myself Dr. Monalisa, and I have done my MD anatomy from Armed Force Medical College, Pune. And this is my code which can be used by you if you want to be the part of free sessions on the Unacademy platform. Also for the free sessions and also for taking the plus subscription, this is the code which can be used by you, and always I come up with the free session. So firstly let me tell you about the free session. So like today also there is a free session. So Wednesday is tomorrow, and Wednesday I am taking 2 free sessions, and today is Tuesday, and on Tuesday I am taking 1 free session on the platform of Unacademy. So today's session, so I will give you the information about the topic and the session taken. So before that let me tell you about the special class features. So when I am talking about special class features, I want you to know that it's a live interactive session where you can participate in the session with live interaction with the top educator of Unacademy platform. And I also want to tell that polls are conducted when the session is going on, where you can ask the doubts right itself in the session. Raise your hand and get your doubts corrected right itself. Never miss a session. So once you start seeing the session, you will get the notification regarding that session. So you start following the educator on the platform of Unacademy, and you will get whole of the session link and also notification. Lecture notes are provided to you. So what happens once the session is finished, what you can do, you can download the PDF notes, and the lecture notes can be utilized by you anywhere, and means at your own place. Study with the top educators of Unacademy platform. So I also want to tell you about free sessions. So I want to give you the information like today. Okay, today is Tuesday, and firstly I want to tell you about my today's free session. This is on the Unacademy platform. So if you want to be the part of general histology MCQ targeting INICET 2021, so what you can do, you can join me at 9 PM session today on the Unacademy platform. So for joining this session, okay, so if you want to join this session, you have to download the Unacademy app, and you have to use the code ANAT10 as the unlock code if you are using the platform for the first time, and you can be the part of the session. That is 9 PM is the timing. So do join 9 PM session today on the Unacademy app. Now other than that, I would also like to tell you the information regarding my tomorrow's session. So tomorrow is Wednesday, and I am taking 2 sessions. So on Wednesday I am taking 2 sessions, one on the 29th of the September, and so that is 29th September is tomorrow, that is Wednesday. The first session is 6 PM and then is 7:15 PM session. So in the first session I am going up with the targeting the students of next aspirants. So I will describe the lymphatic structures histology. So I will describe the lymphatic structure histology and the systemic histology MCQ session targeted for INICET. So today there is general histology MCQs being discussed, and tomorrow 7:15 is the time where I am discussing the MCQs related to systemic histology. So those who want to join, they can join by using the code ANAT10. They can unlock the session and be the part of the session. So do join, dear students. It will be highly beneficial for you before going for the INICET examination 2021. You should revise all the histology slides and MCQs. Now also I want to tell, today on YouTube I am taking first session is upper limb MCQs, then is the lower limb MCQs. The timing is 7:30, and 9 PM will be the timing of the special free sessions on the Unacademy platform. Now what are the benefits of plus subscription? When I am talking about the plus subscription, you can access both the live and the recorded version, study on the device of your choice, and study from the top educators in the medical field. Access more than 25,000 MCQs which are based on the pattern of high yield clinical MCQs of all the 19 subjects compete in the live test and quizzes, and now you will get okay, now you will get also notes provided, PDF notes which can be availed by you. Learn Plex, hello ma'am, Mashood here from Pakistan. Hello, hello, hello Mashood, hello. So yes, now I would also like to tell you about the Iconic subscription. So I want to give you this brief introduction about the platform of Unacademy, because this is the platform which is letting us to connect. Okay, so it is important that all information should be known to you. So after this few introduction, we will start the session. So Iconic subscription is the platform where you get the benefits of both Prep Ladder and Unacademy. Sivank, yeah, good evening dear, where you get the benefits of both the Prep Ladder and the Unacademy clinical integrated versions, video lectures, QBank 3, all can be assessed, rapid revision, snapshots and treasure dream notes of the Prep Ladder. So just grab the opportunity and take the Iconic subscription. So my dear students, I also want to give you the information like first 500 aspirants who are going to take the Iconic subscription, they will get a discount of more than 20%, and again 10% discount for using the code NAT10. So a total of discount is more than 20%, but it is applicable only for the first 500 aspirants who are going to take the subscription of Iconic subscription. So just go and grab this opportunity, use my code NAT10. I also want to tell you about the highly effective QBank of the Unacademy platform, where more than 25,000 MCQs are there. Guljar Vani, good evening dear. You can use this code NAT10 and have the opportunity of solving 25,000 MCQs. Detailed explanation is given for each and every MCQs by the top educators of Unacademy platform. Boost your medical preparation by taking 2 years of subscription and getting 4 months of subscription absolutely free. Boost your medical preparation by taking 12 months of subscription, getting 2 months of subscription absolutely free. Okay, what is here? The great news, NEET PG Compact. So 60 minutes, 45 MCQ scholarship test from a pool of 1 crore rupees. So what is the date dear? So 10th October is the date, 11 AM is the timing, and till rank 200 students is getting the scholarship. So just grab this opportunity, and it is the free test and scholarship test which is on the platform of Unacademy. Enroll it. So you can get enrolled for this test by using the code NAT10. So use the code NAT10, enroll for the compact test. 10th October is the day, 11 AM is the timing, and till 200 ranks will get the scholarship. A pool of 1 crore rupees is there. So grab the opportunity. Good evening Tariq. So okay, before starting the session, I also want to tell you about the NEET PG subscription details, where I have compared the Iconic subscription with that of the Plus subscription. Okay. So here you can choose the Iconic subscription according to your needs, or Plus subscription. If you are in first or second year, go for 3-4 years subscription. Otherwise 1 or 2 years enough for you. Use the code NAT10 for 10% discount. So let's start. So let's start with the MCQ session. So this is the first MCQ. So okay, you will be following. So upper limb session. So MCQs I will first discuss, and 7:30 PM lower limb. So upper limb में important topics I will discuss briefly, which is very important for clinical MCQs. So question number 1, all the best to all the students, all the best Mashood, Sivank, Guljar, Salini and Tariq. Okay, question number 1, a 3-year-old boy is brought to the emergency department for the refusal to move his right upper extremity. His mother states that the child was fine this morning. This morning the child was fine. She recalls that he fell while holding the hands and walking with his old sister 2 hours earlier. On physical examination, he is holding his right upper extremity at the side with the elbow extended and forearm pronated. Any motion of the right elbow produces pain, and there is no visible bruises or edema seen. So which of the following structure is most likely injured in the patient? The options are annular ligament, biceps tendon, interosseous membrane, radial collateral ligament, ulnar collateral ligament. So my dear students, mark the correct answer and your time starts. I will give you 30 seconds for marking the correct answer. So mark the correct answer. Sadaf has given the answer A. What about others? What about others? So important topics of upper limb, and which few of the topics I have discussed, and we are coming up with the important revision before INICET. Lower limb MCQs is also very important, which I will discuss after completing the upper limb MCQs. Okay, so yes, Salini, Tariq, Sivank, D, okay, A and D. So I am getting mixed bundle of answers coming up. So let me see the correct one. Okay, the key point. So let me tell you about the key point. The key point is how the child year. The first key point is the child is just of 3 years old. Okay, and the person is Salin is also telling A, Sadaf is telling A, and Swang D. Okay, mixed bundle of answers are coming up. And the key word, so actually A is absolutely correct answer, that is annular ligament. So here what are the key points which will help you to target the correct answer? So that is the child age and how he is getting the injury. So let me tell you the target point. The patient which is mentioned here, the whole clinical history which is provided is showing that the case is of pulled elbow, nursemaid elbow, or it is called as radial head subluxation. So this is the most common type of elbow injury which is seen in the case of children. Okay, affected children presents with injured arm, and the person will come with holding the arm close to the body with the elbow extended or slightly flexed, and the forearm is pronated. So what I have written, the second point, that is the presentation of the child when he or she come to the OPD clinic. So radial head subluxation on nursemaid knee. So I just want to show you this annular ligament. So here you can see this is the annular ligament which is winding around the radius below the head, as you can see here. And what happens with the sudden pulling of the baby or children's of 1 to 4 years of age, what you can see, the head of the radius is coming out from the annular ligament. So this is called as annular ligament displacement, and this is the case of radial head subluxation or nursemaid elbow. Now, so this is the reason that this the option A is absolutely correct, and many of you have given the right answer. Yes. Now coming to the incorrect option. So one of the option was intraosseous membrane, and I just also want to rule out the incorrect option. So how we will go? We will first go with the explanation of the correct and then incorrect option. So why intraosseous membrane is not the correct answer? The reason is that intraosseous membrane is a broad sheet of connective tissue spanning between the radius and ulna. So it is actually serving as a site for attachment of muscles of the forearm. So it is not injured in this case, and it is not causing the displacement of the radial head or the annular ligament. So this is not the correct answer. Yes. So radial collateral ligament, again radial collateral ligament, which was one of the option provided, it is also not the correct answer, because we know that radial collateral ligament is attached onto the lateral side of elbow, and the major function of it is to give strength to radiohumeral joint. So here you can see actually radial collateral ligament is shown here. Let me slightly highlight this, and here you can see this is the radial collateral ligament which is attaching above to the lateral epicondyle, and lower down it is going towards the olecranon process and also merging with the annular ligament. So it is additionally giving support to annular ligament, but it is not injured in this case, so it is not the correct answer. Now when we talk about ulnar collateral ligament, the other option which was provided was ulnar collateral ligament, which is also the wrong option. And why it is wrong? Because we know that ulnar collateral ligament is attached to the medial side and it is giving strength to the ulnohumeral joint. In this case, you can see here, in this case what you can see, the ulnar collateral ligament is injured. So when the ulnar collateral ligament is injured, it is mainly seen not only in children's. The age which is presented in the MCQ was not correlating to it. Actually the injury is more commonly seen in baseball players, and it is due to intense stress. What is the clinical presentation of the patient? Intense injury nahi tha. Intense injury nahi tha. The elder sister was pulling the baby, or means 3-year-old's boy, and that was the reason. Not an intense injury was given to the patient baby. So this can't be the right answer. And the treatment which is involved for the ulnar collateral ligament construction is given a very particular name. So I just want to share the name of this surgery. So all of you, whenever there is injury of ulnar collateral ligament, again the surgeon will suture it and give the will try to do the operation so that the integrity of ulnar collateral ligament is regained. So that operation name is called as Tommy John surgery. Tommy John surgery. Yes, got it dear? Very good. Okay. Now let's move on to the next MCQ. Okay. So yes, a 53-year-old. Okay, I will just Yeah, this is the question. So I will read it for you. A 53-year-old man presents to the physician office with a dull aching pain in his shoulder. He states that his pain is worsening with the movement and that is often interfering with his sleep. The patient cannot recall any traumatic event prior to the start of the pain, but does report that he experienced increased discomfort after helping his daughter to move into her college room 1 week ago. His past medical history induced dyslipidemia, hypertension, for which he is taking appropriate medicines. Physical examination includes local tenderness over the area just below the acromial process of the scapula. The physician asks the patient to abduct his arm to 90 degrees and flex them to 30 degrees with the thumb pointing to the floor. She then applies downward force to the arm. The maneuver elicits pain in the patient's right shoulder and reveals a right-handed weakness compared to the left. A tendon of which of the following muscle is inflamed in this patient? So you have to, Sadaf has already given the answer. What about others? So a great history, clinical history is given. So many important points has been mentioned, but we have to target the crux point. जब भी clinical questions आता है, much detail of clinical history is given, but यहाँ पे 1 or 2 point is necessary to mark the correct answer. So I think many of you have already marked it right, because you are knowing the point which is giving us the correct answer. Yes. So yes, Rangraj, many, Sadaf, and absolutely right. Supraspinatus is the right answer. Yes, MT Beer can test. Absolutely right, Tariq E. Supraspinatus is the right answer. Okay. Yes. So my dear students, the key point which is helping you to target the correct answer is the location. So what you have seen, the location is just below. The location of the is just below. So localized tenderness is just below the acromial process and a tendon which is inflamed. So the other point which is asked is inflammation and the tendon which is inflamed. So just below the acromial process, actually there is coracoacromial arch, painful arch syndrome. Yes, absolutely right. This is a case of painful arch syndrome, and the condition like supraspinatus calcification, supraspinatus tear, subacromial bursa inflammation, all these will elicit pain in the patient. So see here, it is actually rotator cuff structure. In the rotator cuff structure, the tendon of supraspinatus is commonly affected. The most common tendon to be affected in rotator cuff injury is the supraspinatus muscle. So let me just enlarge this. Can you see here? This is the acromial process. Just below the acromial process, the structure which is shown here is the subacromial bursa. So inflammation of subacromial bursa or sometimes tear of the supraspinatus muscle, and actually this area is the critical zone of supraspinatus tendon getting involved, and this was mentioned in the MCQ. In the MCQ also it was mentioned that supraspinatus muscle tendon, not exactly the name of the muscle, but just below the acromial process there is inflammation and pain. So the correct answer will be supraspinatus muscle. Now, due to superior location, now the next important points which is very important, due to superior location of supraspinatus tendon, it is vulnerable to chronic or repeated injuries and it get impinged between the head of humerus and acromioclavicular joint. Yes, Tariq Siddiqui, absolutely right. He is absolutely right that 0 to 15 degree of abduction, as you can say, initiation of abduction is done by which muscle? Supraspinatus muscle. So that was the maneuver which was performed by the physician also. The motion typically causes inflammation of the whenever we go for any kind of motion like abduction movement is initiated, there will be more pain, aggravated pain, and generally the middle range of abduction will give more pain to the patient. So that is simultaneously abduction or flexion agar hum karenge patient mein, to pain is aggravated. So this is the reason this of correct answer. Let me tell you the incorrect option. So the other option, why biceps brachii is not the right answer. The reason why biceps brachii is not the right answer, is why, because we know that biceps brachii muscle is having two tendons. One is the short head and other is the long head. Okay, so tendon of long head of biceps brachii muscle passes through glenohumeral joint and get inserted into the supraglenoid tubercle of the humerus. Supraglenoid tubercle से arise करता है और biceps brachii is getting inserted into radial tuberosity. So short head is arising from the coracoid process. So actually why I am telling this, why? Because you can see here short head is from the coracoid process, long head is from supraglenoid tubercle, supraglenoid tubercle of scapula. So that means it is not getting impinged. So this is not a location to get impinged. So this is not the right answer. So this explains why biceps brachii is not the right answer. It is not getting compressed below the acromial process. Now coming to the next one is the deltoid. No reason deltoid can be the correct answer. The reason is that deltoid, yes, you can get confused with the, it is also performing the abduction, that is 15 to 90 degree, but deltoid muscle is a quite muscular bulky muscle which is covering whole of the shoulder joint superiorly, anteriorly and also posteriorly. So actually if you see the deltoid muscle origin, it is from the clavicular part, acromial part and spinous part. Okay, so from clavicle and the scapula. So these are not getting impinged below the acromial process and they commonly insert into the deltoid tuberosity. If I highlight this diagram, so you can clearly see the origin of the muscle is from lateral part of the clavicle, from the acromial process and from the spine of the scapula. Together these fibers are inserting into deltoid tuberosity. No chance is there that these bulky muscle is getting compressed below the acromial process. So this is the wrong option. Now moving on to the next, levator scapulae muscle. One of the option was levator scapulae. Again this option is absolutely wrong. It can't be compressed because it is not correlated with the acromial process of the scapula. This is the muscle which is getting origin from the transverse process of C1 and C4 cervical vertebra and getting inserted into superior angle of the scapula. So it is attached to the supromedial border of scapula and the transverse process of C1, C2, C3 and C4 vertebra, and it does not contribute to providing stability to glenohumeral joint. So this is the reason it can't be the correct answer. Serratus anterior muscle, again we know that serratus anterior muscle is attached onto the medial border of the scapula and arises from the 8 ribs. Actually, whenever the serratus anterior muscle is injured, the medial border of scapula is not connected to that of the vertebral column and it's not directed medially. And if you will see this case, and the person will, and the examiner will tell the person to push against a wall, there will be prominence of medial border of scapula. The case is called winging of scapula. So not such kind of description was provided. So this is the case where you can see origin from the upper 8 and 9 ribs, insertion into the medial border of scapula. This is the serratus anterior muscle. So this is the reason it can't be the correct answer. Long thoracic nerve, yes Tariq, absolutely right. Long thoracic nerve is giving innervation. Long thoracic nerve is giving innervation. So with this explanation, it is clear that supraspinatus is the correct answer. Let's move on to question number 3. Now see here, a 12-year-old boy falls from a tree. He is climbing but catches himself on a branch with right hand. So he is falling, the person is falling and then catching on the branch of a tree. He swings by his right arm and jumps to the ground. Several hours later, he presents to the emergency room with right hand clumsiness. So which of the following structure is most likely injured? So yes, overhead abduction is also done by serratus anterior muscle. Yes Shri, you are absolutely right. So moving on to question number 3, mark the correct answer. Which of the following option is correct? Axillary, radial, musculocutaneous, long thoracic or brachial plex lower trunk? The mode of injury or the mechanism of injury is shown here. Okay, so mark the correct answer. Question number 3, mark the correct answer. Your time begins now, all of you. Yes, so Sai Chandra, Kabir, Guljar, A, okay. So, okay. Mixed bundle of answers are coming up. Few of you are giving A, most of you are giving E as the answer and few A as the correct answer. Actually, the correct answer is brachial plex lower trunk injury. So, E is absolutely correct, okay. E is absolutely correct. E option is correct. Now, how I am going to approach to this answer, let me tell you, okay. Don't worry, for the clinical questions, not only the correct option but the incorrect option also I will explain. See the mode of injury. यहाँ पे crux point क्या है, आप कैसे समझ सकते हो कि this is the right answer by seeing the mode of injury. So the mode of injury in this case is the 12-year-old boy is falling from a tree when he is climbing. Okay, when he is climbing. Okay. So yes, A and E. So students are confused between A and E. Let me tell you why E is the correct answer. So the mode of injury, the person is falling and he holds a branch of a tree to rescue himself, and in that case there is overstretching and over abduction of the arm, and this will lead to lower trunk palsy and C8 and T1 nerves will be involved. So this is the reason. And axillary nerve is not correct because it is more commonly involved in anterior dislocation of shoulder. So the correct mode of presentation of the injury which was mentioned in this MCQ is targeting the correct answer, that lower trunk palsy is the correct answer. So yes, let me tell you the correct answer, the keywords. So how you are going to approach this answer? So you are going to approach this answer by the keywords mentioned. The keywords which is mentioned is fall from a tree but catches himself on a branch, swing by his right arm with right hand clumsiness. With right hand clumsiness. Okay. So this is the mode of injury. This is giving us the clue that the correct answer is lower trunk palsy. Now generally when we are talking about lower trunk palsy, which is also called as Klumpke's paralysis. Lower trunk palsy is also called as Klumpke's paralysis, and the other reason will be cervical rib. The other reason can be cervical rib, birth injury, Klumpke's paralysis. Lower trunk presents anterior to the scalenus muscle, anterior to scalenus medius border, and is located on the first rib. So it is elevated by cervical rib and lower trunk can get compressed. So undue abduction occurs. What I told you the same thing I have explained you कि जब भी cervical rib होगा या फिर a person is falling and then holding a branch of a tree to save himself, in that case there is over abduction, there is undue abduction of the arm, and this will lead to lower trunk palsy and involvement of C8 and T1 nerve roots. So please see this diagram where the common reason of lower trunk palsy has been shown. So this one was mentioned in the MCQ, ye wala mode was mentioned in this MCQ, that a person is falling and then holding a branch of tree. The other option which can be injury is cervical rib, because this compresses lower trunk. Cervical rib will compress the subclavian vessels. It will lead to, cervical rib can lead to thoracic outlet syndrome, and it can compress the subclavian vessels and lower trunk of brachial plexus. Also you can see here the person is the obstetrician is going for vaginal delivery, and in that case over or hyperabduction of arm is done. That is the another case of lower trunk palsy. Now lower trunk palsy में जो lesions होता है वो C8 and T1 nerve is mainly involved, and this we know that this will lead to the paralysis of intrinsic muscles of the hand and the ulnar flexors of the wrist and the finger. So along with C8 and T1 in bracket C7 is written, which will also involve flexor carpi unlaris muscle. Now coming to sign and symptoms of the patient. So in case of lower trunk palsy, the person will come with claw hand, and if you will see the claw hand, it will be pronounced in the medial side of the hand and fingers, because of all the intrinsic muscles. Major chunk of intrinsic muscle is paralyzed, and also all the palmar and dorsal interossei are paralyzed, and medial lumbricals are paralyzed. Again, another test to confirm that lower trunk palsy is seen in the patient is that Foreman sign will be positive. Flexion of distal phalanx of the thumb when a piece of paper is held between the thumb and the index finger. So we know that adductor pollicis is the muscle which is supplied by, yes, Khan, it's the claw hand, yes. We know that adductor pollicis muscle is getting innervation from ulnar nerve. So when we hold a piece of paper, for example, I am taking this example, this is a remote and I am holding it. So if my adductor pollicis is perfect, so I will hold a piece of structure like this. Can you see this? Okay, but if my adductor pollicis is injured due to ulnar nerve, I will hold the structure like this. So I am holding this structure like this. Can you see? I will flex. The thumb is flexed. The thumb is flexed. So here the thumb is flexed due to action of flexor pollicis longus muscle. So over action of flexor pollicis longus muscle or taking over the action of adductor pollicis muscle to hold a piece of paper between the thumb and index finger, which is done by the flexor pollicis longus muscle, confirms that adductor pollicis muscle is injured and it will show that ulnar nerve is injured. This is a test which is done to see the integrity of adductor pollicis muscle, and the reason is ulnar nerve injury, and the reason is can be seen in lower trunk palsy. Sensory loss will be also seen in the ulnar side of hand and forearm. So my dear aspirants, see here Klumpke's paralysis, you can see it is pronounced in the medial side of the fingers. This will be okay, but medial fingers will be like this. This is medial claw hand. This is what? Medial claw hand. Yes, other card test and all can be done, like Foreman said. See here what I have performed. This is the Foreman sign which is positive in case of lower trunk palsy. Involvement is C8 and T1 nerve, seen in case of ulnar nerve injury. And Klumpke's paralysis, can you see this? Here what you can appreciate, there is paralysis of this dorsal interossei muscle and palmar interossei muscle. So palmar and dorsal interossei muscle gone. Med Nair, welcome Med Nair. So loss of dorsal interossei muscle integrity, loss of palmar interossei muscle, Foreman sign positive, these all conditions are seen in lower trunk palsy. These all conditions are seen in lower trunk palsy. So my dear friends, other than that, you can see also the case of Horner syndrome, Klumpke's paralysis or Horner syndrome. The patient will have the involvement of T1 fibers, and T1 fibers are carrying with it sympathetic fibers from head and neck region. The T1 fibers is also having sympathetic fibers involved, and because of that, due to the disruption of sympathetic fibers to head and neck region which traverses via T1 nerve, the features will be seen in lower trunk palsy, which is not seen in case of upper trunk palsy, is Horner syndrome. Ptosis, drooping of upper eyelid. So ptosis will be partial ptosis will be there. Constriction of pupil and hydrosis, absence of sweating and sunken eyeball. These all features will be seen in case of lower trunk palsy. Yes, Med Nair, welcome. So yes, see here. Okay. Now my dear aspirants, yes, the question was of lower trunk palsy, but in brief, I just want to tell you about the key features of upper trunk palsy. Is it okay everyone? Med Nair, Niyamat Khan, Alia, Sivang, Tariq, Guljar, Plex, Sadaf. Okay, so just few points about upper trunk palsy, because question तो मैंने lower trunk palsy पे पूछा है, but upper trunk palsy can also come as an examination. So let's quickly revise it. Okay, so yes, can you see here, overstretching of neck has been done in normal vaginal delivery, but stretching of neck is done, and due to this violent stretching of the neck and violent stretching of neck and the shoulder, what will result? Upper trunk palsy will be resultant. Okay, upper trunk palsy will be seen. Okay, upper trunk palsy will be seen in that case. Okay. Okay. The side of the nerve involved, Tariq, the side of the nerves involved, one side only, no. Stretching is done on one side. So, एक unilateral होगा. Tariq, unilateral. It will be unilateral. Lesions of brachial. So, upper trunk palsy में the structures involved. What is C? What is C? What is C? C is SS, suprascapular nerve. What is D? D is nerve to subclavius. See here, the nerves which is affected in upper trunk palsy is C5, C6, anterior posterior division, and this is suprascapular and that of nerve to subclavius. Yes, policeman deformity. So the lesion of brachial plex upper trunk will cause policeman tip deformity. You can see here the baby is having the policeman tip deformity or waiter tip deformity. The arm is adducted and medially rotated, and the forearm is extended and pronated. The forearm is extended and pronated. So the sign and symptoms will be in upper trunk palsy, the person arm will hang by the side, adducted, medially rotated, extended at the elbow, and forearm is pronated. So the function which will be affected, no abduction, no lateral rotation, no flexion, and no supination, and this condition is called as waiter tip or policeman tip deformity. Mainly C5 and C6 nerve roots are involved. C5 and C6 nerve roots are involved. Yes, absolutely right. Now let's move on to the next. Question number 4. A 23-year-old male is evaluated after sustaining a neck and shoulder injury. The nerve indicated, so yes, Okay, now all of you just concentrate on this MCQ, that is MCQ number 4. A 23-year-old male is evaluated for sustaining neck and shoulder injury. The nerve indicated by blue arrow on the illustration of the diagram is injured in this patient. So you have to tell me what will be the resultant injury. That means you have to identify the nerve and you have to tell me the which of the following function is gone. Question number 4. Question number 4. All of you please mark the correct answer. 30 seconds for you. You have to just identify this arrow mark structure. So yes, I am getting answer C, E. Okay, mixed bundle of answers are coming up, C and E. Okay, blue color small arrow as you can see here. Okay, median nerve. Okay, so it means I have to revise it. Okay, so yes, E. Sai Chandra. Okay, so what is that nerve? What is that nerve? E. Okay, E. Many of you are telling E. Who told? Okay, Sri Rangaraj and Khabir. So actually C is the correct answer, dear, and the nerve is yes. So Khan, Alia Khan is also telling right. Extension of hand. Which nerve is this? This is radial nerve, dear. This is radial nerve. Yes, this is radial nerve branch of posterior cord. Okay. So clearly you have to identify the nerve. So that means quickly I will again show you the important nerves from the branches here. So here the radial nerve is involved. यहाँ पे कौन सा nerve involved है? Radial nerve involved होगा. ठीक है. So 23-year-old male is evaluated after sustaining a neck and shoulder injury. Middle trunk. No dear, this is the nerve. This nerve you have to identify. This is RN. This is radial nerve. This is the largest branch of brachial plexus and this is radial nerve. Yes, absolutely right. Now my dear friends, it is important that you should know whole details of brachial plexus. You should know the routes. Roots are formed by C5, C6, C7, C8 and T1 ventral rami. ओके, ट्रंक कितने ट्रंक होते हैं? 3 ट्रंक होता है, अपर, मिडिल एंड द लोअर. C5 and C6 will join to form the upper trunk. C7 will form the middle and lower is formed by C8 and T1. Division anterior and posterior. Yes, C is correct, Sivang. Cords are medial, lateral and posterior, branches from the cords and branches. So all these are important. So what is important for you to know? Which are supraclavicular part and which are infraclavicular. Infraclavicular part of the brachial plexus, cords and the branches. So what is important? Just see in quickly the formation of brachial plexus. See quickly the formation of brachial plexus. Okay, so here you can see C5 and C6. What is these? These are all roots. Okay, C5 and C6 will join to form upper trunk. C7 will form the middle trunk, C8 and T1 will form the lower trunks. This is formed by the ventral rami. So, roots are formed by the ventral rami of C5, C6, C7, C8 and T1. Now, what you can see in this diagram, this is A, okay, what is this? Blue color is A and what is yellow color? Yellow color is P, yellow color is P. So, see here all the yellow posterior cord means all the P color or the posterior cord will join, all these posterior division will join to form the posterior cord of brachial plexus, and here you can see lateral cord is formed by joining the anterior division of upper and middle, and medial cord is formed by the anterior division of lower, okay, upper trunk, yes, up, and you can see here lower trunk anterior division is forming medial cord. Actually, this diagram is very easy for you to understand the formation of brachial plexus, okay. Just see here what I will do. This is very easy to understand the formation, okay. So, you can use here blue color and yellow color, okay. So, यहाँ पे blue color is for anterior division and yellow color is for posterior division. So, you will understand the formation of all the cords. Now, after that, I also want to tell that sometimes the formation will be prefixed and postfixed. So, when the formation of brachial plexus is taking the contribution of C4, then it is prefixed, it is seen in 10% of the cases, and when it is formed by taking contribution from T2, it is called as postfixed brachial plexus. Roots lies behind the scalenus anterior muscle, emerges in between scalenus muscle. Trunk is lying in the lower part of the posterior triangle, division is lying behind the clavicle, and cords are arranged around second part of axillary artery. What do you mean by the word second part of axillary artery? Any idea? What do you mean by the word second part of axillary artery? That means the medial cord will lie medial to second part of axillary artery, the posterior cord will lie posterior to second part of axillary artery, and lateral cord will lie lateral to the second part of axillary artery. Means according to the name they are arranged. According to the name of the cord, they are arranged around the second part of axillary artery. So, quickly see the branches because this was asked in the MCQ and a few of you have getting confused. So, it is important that we should revise it. Yeah. So, this part is the roots. This is C5, this is C6, this is C7, this is C8 and T1. Okay. So, from the roots the branches are, this is DS. DS means dorsal scapular, and what is this? This is LTN, long thoracic nerve. This is long thoracic nerve. Yes, second part is lying behind the pectoralis minor. Absolutely right, Khabir, absolutely right. So, DS, okay. So, DS is, so we have got two branches. So, this is DS. DS is the branch from the root and long thoracic nerve. Now, my dear students, this is the trunk. Okay, this is UT for upper trunk, this is MT for middle trunk, and this is LT. Now, only the branch is there from the upper trunk. So, from upper trunk, this is SS and this is NS. What do you mean by NS? NS means nerve to subclavius and SS means suprascapular nerve. Okay. Now, the next division which you are seeing, this is the division. This part is the division. Okay. So, this is A for anterior division. This is also anterior and this is also anterior, and we will write P here for the posterior division. So, this all P are you seeing here? This all P is together forming the posterior cord of brachial plexus. So, seeing the branches of posterior cord, firstly this is AN means axillary nerve, and this part is the radial nerve. This part is the radial nerve. Okay. So, firstly I am showing you the branches of posterior cord of brachial plexus. Other than that, this is this is nerve to latissimus dorsi, thoracodorsal nerve. In other way, it is thoracodorsal nerve. So, it is thoracodorsal nerve, TDN. This is US for upper subscapular and this is LS for lower subscapular. Is it okay? So, all the branches of posterior, yes, no branches from division, absolutely right Tariq. There is no branches from the So absolutely right, Tariq, there is no branches from the division. So I am showing you the branches from the posterior cord. AN for axillary nerve, radial nerve, upper and lower subscapular, and TDN means thoracodorsal nerve. Now moving to the branches of medial cord and lateral cord. So let's see firstly the branches of lateral cord. So lateral cord, this is LPN, lateral pectoral nerve. Okay, this is musculocutaneous nerve, and this part is the lateral root of median nerve. So this big nerve which you are seeing is MN, that is median nerve, and this is the lateral, L for lateral root of median nerve, and here you can see the other one, this will be M for medial root of median nerve, which is from the medial cord, and here we have got other branches. So this is UN. What do you mean by UN? Ulnar nerve. So ulnar nerve, medial cutaneous nerve of arm, and lower to it, this nerve is medial cutaneous nerve of forearm. This is medial cutaneous nerve of forearm. Okay, so is it okay? We have done all the branches, and this part is MPN. This is medial pectoral nerve. So yes, medial pectoral nerve. So all of you do revise all the branches of brachial plexus. So in this diagram, I have written all the branches of brachial plexus, and all of you do revise all the branches of brachial plexus. So we have done in this diagram, and in the literature part, just have the quick review. Okay. So see here, branches from the root. So sometimes, actually please note down, sometimes nerve to subclavius can also be the branch from the root. Sometimes, okay. So actually nerve to subclavius at times can be branch from the root also. Sometimes, it's not always, sometimes, not always, sometimes, okay. Other dorsal scapular, long thoracic nerve, some unnamed nerve from the scalenus and longus colli muscle के लिए, and C5 root of phrenic nerve. So all these which I have written are showing the branches from the root. Sometimes nerve to subclavius can be a branch from root. So अगर MCQ में ये point पूछा गया है, तो you can note down this point. Okay, write down this. Sometimes nerve to subclavius can be a branch from the root. Please note down this. Branches from upper trunk, nerve to subclavius and nerve suprascapular nerve. No branches from division, absolutely right. Some of the students has already given this answer. Branches from lateral cord, lateral pectoral nerve, lateral root of median nerve, musculocutaneous nerve. I would like to give you a mnemonic, ML, medical leave 2. निमोनिक इज मेडिकल लीव 2. ओके, मेडिकल लीव 2. यहाँ पे M मेडिकल लीव के लिए M क्या है? मेडिकल लीव का M musculocutaneous nerve L2. L2 means lateral pectoral nerve and lateral root of median nerve. Now coming to the branches for the medial cord. 5 branches from the medial cord, and the mnemonic will be M for you, me for you. Okay, me for you means 4M. How many M? 4M. 4M are medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, and U ulnar nerve, lunar, LML. Okay, yes, any of the mnemonic which suits you. Okay, any of the mnemonic which suits you, you can make. So it is the me for you, 4M and 1U. Now branches from posterior cord. So I am writing rats in the upper self and lower self. So you can write according to your mnemonic. यहाँ पे मैं लिख रही हूँ rats. Okay, तो यहाँ पे rats R for radial nerve, A for axillary nerve, T for thoracodorsal nerve, S for upper and lower subscapular. So upper rack or lower rack. Got it? So the mnemonic is rats in upper and lower self. R for radial, axillary, thoracodorsal in upper and lower self. Okay, so rats in the upper and lower self. So yes, we have done with this. So the question is a direct question, and after discussion of the brachial plexus in detail, we are correct. So now coming to the answer of this question. So this question which I have asked, it is a direct question, question number 4, which is clearly asking you for the identification of radial nerve. So for identifying all the branches of brachial plexus, now we have discussed the image and now we are knowing all the branches of brachial plexus. Radial nerve is the largest branch of brachial plexus, and in addition to supplying the skin of posterior arm and the forearm, it is supplying all the extensor muscles of arm and forearm. So only extensor muscles is paralyzed and wrist drop will be seen. So loss of all extensors of elbow and wrist, inability to grasp the object and loss of sensation. These are the clinical presentation if there is radial nerve injury. Loss of sensation over posterior surface of arm, forearm, lower lateral aspect of the arm, dorsum lateral part, digit, lateral 3.5 of the digit till the level of nail buds. Not the nail buds. Why the nail bud is not involved? Any idea? Because nail buds on the lateral part is supplied by median nerve. Got it? Ultra. Yeah. Now coming to question A. Option A. Damage to median nerve leads to loss of flexion of lateral finger, pointing index. So one of the option was median nerve injury. Median nerve can't be the answer, because if median nerve is injured, the presenting feature will be carpal tunnel syndrome, loss of opposition of thumb and abduction, and pointing index finger. So this presentation was not given. So this can't be the right answer. Yes, absolutely right, everyone. Damage to recurrent branch of median nerve is again not the correct answer, because actually this is the deep branch which will limit the abduction and patient is not able to hold the structure between the thumb and index finger. So this is also not the correct answer. Choice number D, damage to deep branch of ulnar nerve could limit the thumb abduction and due to paralysis of which nerve? So thumb adduction is involved and thumb adductors. Adductors means adductor pollicis is injured, which is getting innervation from? Which is getting innervation from ulnar nerve. Damage to median nerve. So this is again not the correct answer. Damage to median nerve affect opposition of thumb, and the most reliable sign for median nerve lesion is loss of abduction and opposition of thumb. There will be loss of opposition and abduction of the thumb. So got it, everyone? Let's move on to question number 5th. Okay, question number 5th. A 24-year-old mountain climber present to the emergency room with right shoulder pain following a fall. He was climbing a cliff at a nearby national park when he lost his grip and fell approximately 5 meters onto the boulders below. He says he landed on his right arm and heard the bone snap. Physical examination reveals total inability to extend the right wrist. The X-ray reveals a fracture of right humeral shaft. So which of the following artery is most likely to be injured in the patient? So the options provided are anterior circumflex humeral artery, brachial artery, common interosseous artery, deep brachial artery, and radial collateral artery. 5 options are there. All the best students, mark the correct answer. The time begins. 30 seconds will be provided to you. 30 seconds. Mark the correct answer. Okay, so Tariq has given the answer. What about others? The key point is provided here. There are certain keywords which is mentioned and that will help you to give the correct answer. Okay, so mixed bundle of answers are coming up. So yes, EBD, okay, EBD, mixed bundles of answers are coming up. Okay, Rangraj is telling it's A. So I got A also as an answer. E, B, D means बहुत confusion hai. Means there is so much of confusion. Let me tell you the correct answer. The correct answer is deep brachial artery. D is the correct answer. Oh, Med Nair, absolutely right, dear Med. Med Nair has given the right answer. I will tell you how. My dear students, the key point जो आपको mention था, इंजुरी तो हुआ है, okay, the x-ray. So I will just go to the key points. Okay, the person has fallen down in the national park and then he is not able to grip and a bone snap, that is all okay. But the key point is physical examination reveals inability to extend the right wrist. So my dear student, अगर inability to extension है means which nerve is involved? Which nerve? Everyone, which nerve is involved? अगर inability to extend the wrist है, inability to extend the wrist, so कौन सा nerve involved है? Anyone can give me the answer? Okay, mixed bundle of answers are coming up. Okay, Swank, D. Okay, all others, can you give me the answer? Which nerve is involved? Inability to extend the radial. Yes, radial nerve is involved. Absolutely right. Means radial nerve is, yes, Sri Rangraj, absolutely right. So radial nerve is involved. Okay. Yes, everyone is now right. Everyone is now right. Radial nerve. Abhi suno. Radial nerve is involved. Now please tell me, in the scapular region, lower triangular space, radial nerve is traversing along with which artery, or in the spiral groove in the humeral shaft, radial nerve is crossing along with which artery? Now you only will tell me the answer. Radial nerve is crossing along with which artery? What is the answer? Radial nerve is crossing along with which artery? Anyone wants to give me the answer? Alia Khan, okay, radial. So which artery? In the humeral shaft, in the spiral groove. So see here, right humeral shaft is injured. Profunda, absolutely right. Profunda brachii artery. So actually profunda brachii artery, other name is deep brachial artery. Profunda brachii artery is called as deep brachial artery, and this travels through lower triangular space in the humeral shaft in the spiral groove. Absolutely right. So which will be the correct answer? D will be the correct answer. Everyone, is it okay? Now see here. I will show you this diagram where I am highlighting it. So when I highlight it, what you can see, the radial nerve and the deep artery of the arm is traversing here. Radial nerve and deep artery is located in the posterior, is located on the posterior shaft of the humerus bone. Clearly in this diagram we can see that posterior shaft of humerus bone, radial nerve and the deep artery of the brachial artery is traversing. So mid shaft injury of the humerus fracture is associated with radial nerve and with deep brachial artery. Radial nerve innervates most of the forearm extensors at the elbow and most of the hand extensors at the wrist. So the clinical presentation जो involved था इस case में, that was loss of wrist extension, and loss of wrist extension, that means radial nerve is injured, and radial nerve is injured, so the artery which is lying close to it will be injured, and we know that the artery which is lying close to radial artery, radial nerve is the profunda brachii artery. So profunda brachii artery is the correct answer. Yes, absolutely right. Who is this? Okay, Mafiz, absolutely right. Brachial artery is involved in supracondylar fracture. Absolutely right, dear. Now see here, anterior circumflex humeral artery is a branch of axillary artery that passes anterior to surgical neck of the humerus. Now let me, so we have got the right answer. Now I will tell you why the other option are wrong. One of the option was anterior circumflex humeral artery. So all of you know at the surgical neck of humerus. Okay, अभी मैं बताऊंगी कि जो other options है, other option which is mentioned is absolutely wrong. So I would like to discuss why the other options are wrong. The other options, like one of the option, that is anterior circumflex humeral artery, is not the correct answer because surgical neck of humerus में जो artery anastomose कर रहा है, wind कर रहा है, that is anterior and posterior circumflex humeral artery, which is forming a loop in the surgical neck of humerus. So if we have to mark it right answer, so we have to go for the surgical neck of humerus as the level of injury, and the level of injury which was mentioned in this MCQ was in the humeral shaft posteriorly. So this is not the correct answer, and along with surgical neck of humerus, the fracture line or injury which is causing injury of anterior circumflex humeral artery will also injured which nerve? Axillary nerve. My dear friends, axillary nerve will be injured. Axillary nerve will be injured. And all those who are listening, so I will give you 15 minutes break 10 minutes break and 7:30 में lower limb का session है, that is very very useful, all new questions made and do attend that also. Okay, I want that continuity to be maintained today. तो आज अपना time anatomy को dedicate कर देना है. Okay, today and tomorrow, is it okay? Today and tomorrow. So today and tomorrow, and then 1 or 2 days I will give you gap. So today and tomorrow you can complete many of the parts of anatomy. So brachial artery. Brachial artery is not the correct answer, and as one of the student has already given me the answer, that is Mafiz, and the correct reason for its injury is the supracondylar fracture of the humerus, and brachial artery is crossing anteromedially with the bicipital groove, and it gives branches, that is radial and ulnar artery, which enters into the forearm, and the reason to be injured and the correct anatomical landmark which causes injury is the supracondylar fracture of the humerus injuring brachial artery. So my dear friend, common intraosseous artery is also not the correct answer. Why? We already know common intraosseous artery is a branch of ulnar artery. ये किसका branch है? Ulnar artery का. And we know that ulnar artery is giving subsequent branches like anterior, posterior, recurrent intraosseous arteries, and they are given at a lower level, not at the level which was mentioned in the MCQ, that is shaft of humerus. So this is not the correct answer. Radial collateral artery is again not the correct answer, because injury to radial collateral artery is less likely because it originates from lower end of the spiral groove. So yes, थोड़ा सा confusion हो सकता है radial collateral artery को लेके, but exactly अगर radial nerve is involved and the most closest artery, उसके vicinity में सबसे close artery जो lie करता है radial nerve में, वो तो करेक्ट आंसर इज प्रोफंडा ब्रेकाई आर्टरी. अगर हम रेडियल कोलैटरल आर्टरी की बात करें तो इट इज गिवन एट द लोअर लेवल ऑफ द स्पाइरल ग्रुप. ओके, गॉट इट. So radial collateral artery is not the correct answer. It is also lying close to the spiral groove but at the lowermost part, so it is not the correct answer. So we will choose what? Deep brachial artery, that is also called as profunda brachii artery. So yes, done with this. Let's move on to question number 6. A 45-year-old Caucasian females present to your office with numbness, all the best for the question number 6, numbness with the right palm. After taking a detailed history and doing a physical examination, you suspect a median nerve lesion at the wrist. Before reaching the wrist, the median nerve courses between. So in this question, actually this is a clinical question, but here the course of the nerve is asked. The course of the median nerve is asked. So clearly the question is asked about the course of the median nerve. So according to you, which is the correct answer? A. Biceps and coracobrachialis muscle, flexor carpi ulnaris, flexor digitorum profundus, flexor digitorum superficialis, flexor digitorum profundus, olecranon and medial epicondyle of humerus or supinator muscle or head of the radius. So according to you, which is the correct answer? Question number 6. Sri Rangraj is telling C, 6C, okay. Mafiz is telling B. Niyamat is telling C. Okay, mixed bundle of answer. मुझे B या C answers मिल रहे हैं. Most of the options are either C or B. Okay, so yes, okay. So let me tell you the correct answer here. So here the key point is median nerve की injury बतानी है, and we have to suspect a median nerve injury lesion at the wrist. So before reaching, means course बताना है median nerve का before reaching the level of the wrist, exactly it is lying between which two muscle. So yes, mixed bundle of answers and more of B and C. The answers which is coming of the confusion B और C में है. Median nerve dear, ये median nerve है, तो flexor carpi ulnaris को क्यों ले रहे हो B? So B तो absolutely wrong होगा. The correct answer is C. Flexor digitorum superficialis or flexor digitorum profundus is the right answer. Okay, that is the course of median nerve before reaching the wrist. Why taking consideration of flexor carpi ulnaris? That is more medially. Now see here, I will firstly explain the whole course of median nerve which is right and then the incorrect option. Median nerve enters the flexor compartment of the forearm. So firstly, how the median nerve is reaching the flexor compartment of forearm. So exactly the course of median nerve is that it is passing between humero-ulnar and radial head of flexor digitorum superficialis. Median nerve enters the flexor compartment of the forearm, and exactly it is traversing between humero-ulnar and radial head of flexor digitorum superficialis, FDS. मीन्स दोनों हेड के बीच में, FDS के ह्यूमरो अल्नर और रेडियल हेड के बीच में ये ट्रैवर्स कर रहा है. देयर आफ्टर इट इज पासिंग, सो दिस वाज द करेक्ट आंसर, एंड देयर आफ्टर द कोर्स विच यू आर सीइंग हियर, इट इज पासिंग बिटवीन FDS एंड FDP. What is FDS? FDS का मतलब flexor digitorum superficialis and flexor digitorum profundus. So it is passing between flexor digitorum superficialis and flexor digitorum profundus, and it is closely applied to the posterior aspect of the muscles. Yes. So biceps and coracobrachialis is not the correct answer, and the reason is that actually this course is for musculocutaneous nerve. This is not the course for median nerve. Musculocutaneous nerve is the terminal branch of lateral cord of brachial plexus, and it gives innervation to all the three anterior muscle of the arm. It is coursing in the coracobrachialis, passing and giving innervation to biceps brachii-brachialis muscle. It also forms a lateral cutaneous nerve of forearm as the cutaneous branch. So actually when the nerve is involved, it will relate to the weakness of flexion of arm and sensory loss to the lateral aspect of forearm. So this course is not for the median nerve. Biceps and coracobrachialis is the course for the musculocutaneous nerve. So it can't be the correct answer. Option B, जो आपने बहुत लोगों ने ये भी आंसर दिया, actually this is also not right. Why? Because this is the course for ulnar nerve. Ulnar nerve is resting on flexor digitorum profundus, and it is overlapped by flexor carpi ulnaris. So this is the whole course that is between FDP and FCU, that is flexor carpi ulnaris, is the course for the ulnar nerve. If it is injured, the resultant will be paralysis of the intrinsic muscle and leading to the condition of claw hand. Olecranon process and the medial epicondyle of humerus. The olecranon process and medial epicondyle of humerus is again not the correct answer, because we know that olecranon process is lying posteriorly. It is the prominent part of the ulna which is lying on the posterior aspect, and in between the olecranon and medial epicondyle, the nerve which is traversing is the ulnar nerve. So this is the course of ulnar nerve. We can feel behind the medial epicondyle here. This is olecranon process and this is medial epicondyle. Okay, this process is medial epicondyle and this is olecranon process. So यहाँ पे कौन सा nerve traverse हो रहा है? Ulnar nerve. Okay, this is for the traversing of ulnar nerve. So that is again not the right answer. It is traversing between the medial epicondyle and olecranon process, and this is a common injury for location of injury for the ulnar nerve. Supinator muscle and the radial head of humerus. Okay, so radial nerve is coursing through the supinator muscle, and if it is compressed or involved, the resultant will be wrist drop due to the fact that radial nerve is innervating the extensor muscles of the hand of the forearm. So radial nerve course hai. This is for the radial nerve course, not for the ulnar median nerve. So this is the wrong option. Okay, my dear aspirants, let's move on to the next MCQ, that is question number 7. All the best for everyone. So we have got 10 questions, so 2-3 questions more. Question number 7, mark the correct answer. A 34-year-old female presents to the emergency room after falling in the bathroom. She complains of the wrist pain and numbness in her right palm. Based on her symptom, you suspect that she has dislocated the lunate bone in the wrist. Identify the lunate bone in the X-ray. Identify the lunate bone in the X-ray. So your time starts now. Mark the correct answer. Whether it is A, B, C or D. C, okay, you can clearly see, let me slightly enlarge it. Okay, you can clearly see the radiological image, and you have to identify lunate bone is disclosed. Means you have to identify lunate bone. Which is the lunate bone? You have to identify whether it is A, B, C, D, E. You have to identify the lunate bone. Slightly enlarge, I will. Now you can clearly identify lunate bone. Which is the lunate bone? Take your time. Devnath is telling C. Mahfij is telling D. Kabir is telling D. Okay, mixed bundle of answers are coming up. Question number 7. Okay, what is the right answer here? So yes, many of you are telling D and few of you are telling C. Actually, the correct answer is D. So D is the lunate bone. Okay, D is absolutely the lunate bone. So for marking it correct, already it is mentioned that lunate bone is fractured. So we have to identify the lunate bone. So actually the crux point how to identify the lunate bone here is, okay, see here, this is the ulna bone and this is the radius bone. Radius bone is articulating so this will be the lateral side and this will be the medial side. So if we will go proximal row, this C will be the scaphoid bone and adjacent to C is the lunate bone. So D is lunate bone and C is scaphoid bone. Okay, so the C looks too pretty, try to catch her. So the first lateral most bone for the proximal row is C and D is the lunate bone. D is the lunate bone. Okay, this will be triquetral and this will be pisiform. P for pisiform and this will be triquetral. Okay. So yes, let me show you this diagram. So okay, the correct answer, so a fall on outstretched hand, dorsiflexion and the hand is dorsiflex is the classical injury presentation for lunate bone. So choice D is absolutely correct. And why? Because it is the proximal row carpal bone and it can be identified by the reason that it is the medial one part of the bone which is articulating with the radius bone. So see here a clear image I have shown, I am going to show you. Let me slightly highlight it. Okay, all of you, yes. So now this will help you to understand that how you are going to identify. So in that picture also I have given you the guidelines, but here again you can see here very nicely this is the radius bone, no doubt about this. Radius and ulna bone, all of you can see. Now I will highlight. So the most lateral bone, C looks too pretty. What is the mnemonic? C looks too pretty. Try to catch her. So what is the mnemonic? This is the proximal row. So this is P for proximal row and this is D for the distal row. So starting with the proximal row, scaphoid, adjacent to is the lunate, then is the triquetrum and just over the triquetrum, on the top of the triquetrum, the bone which is resting is the pisiform bone. Now moving to the distal row, the first bone is trapezium, adjacent to it is trapezoid, the largest bone is the capitate. Okay, catch her, her for hamate. So is it clear everyone? Everyone, is it clear how this is how you are going to identify the carpal bones in the proximal and the distal row by seeing this image where the proximal and distal row of carpal bones are there, and clearly the crux point for identification of the lunate bone is that this is the medial bone of the proximal row which is articulating with that of the radius bone. It is articulating with that of the radius bone. Got it? Now moving to the others. So option A is not correct because option A is trapezium and it is the lateral most part of the bone of distal row. Option B is not correct because it is the capitate. C, scaphoid is more lateral one, so it can't be the correct answer. And E is triquetrum bone of the proximal medial wrist, which is again forming a small articular surface of the distal ulna. So is it okay? Yes, pisiform is P-shaped. Everyone, so is it okay? I have explained the all carpal bones in this, and here also the crux point for identification of D is that it is the bone which is articulating with the radius. So have everyone understood? Let me know so that I can move to next MCQ. So let me know, do you want me to explain once more or is it okay? Is it clear? Give me a thumbs up so that I can proceed to the next MCQ, or is it okay? You want me to explain once more or is it okay? Okay, so yes. So let me come up with the next MCQ, that is MCQ number 8. Okay, yes. MCQ number 8. A 33-year-old male slips while working in his yard and falls on outstretched hand. He later presents to the emergency room complaining of right shoulder pain On physical examination, there is flattening of right deltoid muscle and insensitivity of the skin to the pinprick. So, which of the following injury is most likely the reason for the condition? So, options are anterior dislocation of humerus, coracoacromial joint subluxation, clavicular fracture, spiral fracture of humeral shaft, fracture of coracoid process, rotator cuff tear. According to you, which is the correct answer? Cleared? Okay, great. So, question number 8, mark the correct answer. Okay, so we will just finish in another 10 minutes because 7:30 is the timing. So, all of you be connected. 7:30 is the timing for the lower limb MCQs, clinical MCQs. So, we will be connecting. Firstly, we will complete these MCQs and then 7:30 p.m. is the lower limb clinical MCQs. Yes. So, A option is absolutely correct, absolutely right. A option is absolutely correct, anterior dislocation of humerus. Why? The key presentation is deltoid muscle gaya hai, paralyzed hai, or skin over this area is also not having sensation. So, most common injury is why axillary nerve, and we know that axillary nerve is supplying the muscle deltoid. Axillary nerve is supplying the muscle deltoid, and the most common type of injury which is causing axillary nerve injury is anterior dislocation of the humerus bone. Now see here, glenohumeral joint is the most commonly dislocated joint in our body. It is an articulation between humeral head and glenoid fossa. Basic points already known to you. The anterior dislocation will involve forceful external rotation and abduction of shoulder, and with this injury, the anterior dislocation is related with the protrusion of acromion and anterior axillary fullness, and axillary, this will lead to injury to which nerve? Axillary nerve is injured, and when axillary nerve is injured, deltoid muscle is paralyzed and the skin over this area is also involved, cutaneous. Now, so we have got the correct answer. Why other options are not correct? Acromioclavicular joint subluxation is not correct because acromioclavicular joint will be resulting from downward blow on the tip of the shoulder and will produce upward displacement of the clavicle. It is not associated with any kind of specific major nerve injury or any kind of sensory deficit. So, this is the reason B option is not correct. Clavicular fracture is also not correct because yes, Sivank, absolutely right. Learn plex, absolutely right. So, most fractures of the clavicle is involving the middle third, and it will produce local tenderness and swelling. No neurological damage is rare. So, again this is not the correct answer. Spiral fracture of the humeral shaft. So, when we are talking about spiral fractures of humeral shaft, it is again not the correct answer because it results from torsion which is occurring when one falls on the outstretched hand. And generally, if there is spiral fracture of humeral shaft, this will be involved with swelling, crepitus, ecchymosis of the arm, and the most commonly nerve to be injured in case of humerus shaft we have just seen is the radial nerve. Okay dear, okay dear. Fracture of coracoid process. Okay, deltoid muscle paralyzed, that was also very good clue. Fracture of coracoid is very rarely fractured, and this can't be the correct answer, and it is fractured mainly in individuals who are involved in shotgun or rifle related sports injury. So, this can't be again not the right answer. Now, moving on to question number 9th. A 19-year-old female presents to your office complaining of right hand clumsiness. Physical examination reveals decreased sensation over the fifth finger and flattened hypothenar eminences. So, which of the following nerve is involved? Carpal tunnel, hook of humerus, surgical neck of humerus, head of radius, coracobrachialis muscle. So, we have got 5 options. Mark the correct answer. Question number 9th. All the best. Mark the correct answer. Okay, so mixed bundle. Okay, Shri has already given the answer. What about others? The clinical The hint which is provided is sensation over the fifth finger gone and flattened hypothenar eminences. So that means yes, absolutely right, ulnar nerve is involved and the location is hook of hammer. So B is perfectly right answer. Yes, B is the perfectly right answer, absolutely right. Ulnar nerve provides sensation to the fifth digit and medial half of the fourth and palmar aspect, medial palmar aspect of the hand. It innervates all the intrinsic muscles of the hand and also palmaris brevis muscle, third and fourth lumbricals and adductor pollicis. Which muscle? Adductor pollicis. That means it is involving or giving innervation to intrinsic muscles of the hand. In wrist, ulnar nerve passes between, if we talk about the wrist, ulnar nerve passes between hook of hamate and pisiform bone and passes in Guyon's canal. So this location where the ulnar nerve and ulnar artery is traversing, that is between the hook of hamate and pisiform bone in an osteofibrous tunnel, is called as Guyon's canal, which will cause dystocia of the ulnar side of hand and also the innervation of intrinsic muscles of the hand will be affected. This was the clue which was provided. So ulnar nerve is the right answer. Carpal tunnel can't be the right answer because carpal tunnel involved hoga, so which nerve is involved? Median nerve is involved. In this case, patient will have the involvement of median nerve. Surgical neck of humerus is again not the correct answer because it will lead to involvement of axillary nerve. Yes, Foreman sign is also related with ulnar nerve injury. So axillary nerve and deltoid muscle will be paralyzed and loss of sensation over lateral upper aspect of the arm. So this was not mentioned, so this can't be the correct answer. Head of the radius is again not the correct answer because when the head of the radius is involved, the deep branch of radial nerve will be involved due to subluxation, and if radial head subluxation of nursemaid knee and nursemaid elbow is involved, the patient hand will be in the extended and pronated arm and this will lead to wrist drop or involvement of radial nerve and paralysis of extensor compartment muscle. This was not the clinical history presented in the MCQ, so this is not the right answer. Coracobrachialis is not the right answer because it's a muscle of flexor aspect, lies deep to the biceps brachii and overlies in the median nerve and brachial artery. It is innervated by which nerve? Musculocutaneous nerve, and it will be affecting musculocutaneous nerve injury. So this is not the correct answer. Rotator cuff tear is not the correct answer because rotator cuff tears is mainly involving the rotator cuff muscle. Basically, most importantly is the supraspinatus muscle is involved. Other muscles can be also involved. So this can't be the correct answer. Question number 10, all of you mark the correct answer for question number 10. A 30-year-old man underwent excision of right radial head. Following the surgery, the patient develops inability to extend the finger and fingers and thumb of the right hand. He did not have any sensory deficit. Which of the following is most likely the cause? A. Injury to posterior interosseous nerve, iatrogenic injury to the common extensor origin, injury to the anterior interosseous nerve and high radial nerve injury. According to you, which is the correct answer? Question number 10. Mark the correct answer. Question number 10. The key point which is mentioned is inability to extend the finger and the thumb of right hand. Extension is involved, but no sensory deficit. No sensory deficit. Actually, the answer will be involvement of deep branch, deep branch of radial nerve, and the correct answer will be involvement of pin nerve, that is posterior interosseous nerve. The correct answer will be involvement of pin nerve, that is posterior interosseous nerve. So A is the correct answer. A is the correct answer. Got it, everyone? This is the reason A is the correct answer. Okay, my dear aspirants, now before ending the session, I want that you should know that my unlock code is ANAT10. Today 9 p.m. and also tomorrow 2 sessions are there. Tomorrow 2 sessions are there on the Unacademy platform. Do join me live for the session. Okay, so free special session. Today 9 p.m. is the timing for the discussion of MCQs of general histology topic. 9 p.m. on the special class. ANAT10 is the code. Download the Unacademy app. Join my free session. 9 p.m. is the timing on the Unacademy app. Free special class, tomorrow free special class, 2 sessions I am taking. One is the histology of lymphoid structure, other is systemic histology MCQ session which is for INICET. What I am targeting, INICET examination के लिए systemic histology का MCQ discuss होगा. All those who want to join me, download the Unacademy app in your mobile and you can join me. The link will be provided on all the Unacademy Telegram groups. Use the code ANAT10 to unlock. So this is tomorrow. These 2 sessions which I am taking is on the tomorrow, but it is on special class session. Means special class means Unacademy app पे आपको session देखना पड़ेगा. And now my dear students, what we have finished now is the upper limb clinical anatomy MCQs, but now I will take from 7:30 p.m. just after 5 minutes I will take. So 7:30 p.m. lower limb clinical anatomy MCQs. Those who are available, do join for the lower limb MCQ session. So we will quickly 10 MCQs, clinical anatomy MCQs targeted for INICET examination lower limb. So do join me live on the YouTube session for 7:30 p.m. Use my code ANAT10 to see the sessions on the Unacademy platform. Tomorrow 2 sessions are there. Also, before ending the session, I would like to tell you the first 500 aspirants who are going to take the subscription of iconic subscription of Unacademy, they should use my code ANAT10 for 10% discount and avail the opportunity of getting a discount of more than 20% at a discounted rate. Grab, only the first 500 student can grab this opportunity. Also, I want to share once more with you, those who have missed out, that do join 10 October 11 am for the NEET PG Compact scholarship from a pool of 1 crore rupees. Till 200 ranked students are getting the scholarships. Okay. So, just grab the opportunity, just enroll the test by using the code ANAT10. So, what you can do, you can use the code ANAT10, get enrolled for the test, NEET PG Compact test, 10th October, 11 am is the timing. Do join and all the best to take the scholarship. Thank you so much. No, thank you. All of you, please don't give me thank you. Again, join me for the lower limb session just now in 5 minutes. Thank you so much. All the best.